Are you dreading every trip to the bathroom, wincing in pain as you sit, or feeling an unbearable itch that just won't go away? If you've ever dealt with piles, hemorrhoids, you know how frustrating and uncomfortable they can be. The good news? You don't need surgery to find relief. Many people successfully treat piles at home using simple lifestyle changes, natural remedies, and over-the-counter treatments. Whether you're dealing with mild discomfort or severe pain, there are proven ways to shrink hemorrhoids, soothe irritation, and prevent them from coming back without invasive procedures. In this video, we'll walk you through the best non-surgical treatments to help you get rid of piles naturally and regain your comfort and confidence. Hello, friends. Welcome back to Essential Cures. What are piles and why do they happen? Piles, also known as hemorrhoids, are swollen or inflamed blood vessels in the rectum and anus. They develop when excessive pressure is applied to the veins in the lower rectum, leading to swelling, discomfort, pain, itching, and sometimes bleeding. Piles are very common and can affect people of all ages, but they are more prevalent in adults, particularly those who experience frequent constipation, sit for long periods, or have a family history of hemorrhoids. Piles are often compared to varicose veins, as both conditions involve the enlargement and inflammation of veins. They can be internal or external, depending on their location. Internal piles, these develop inside the rectum, making them invisible to the naked eye. They are usually painless because the rectum has fewer pain-sensitive nerves. However, they can cause bleeding, especially during bowel movements, which may appear as bright red blood on toilet paper or in the stool. In some cases, internal piles may prolapse, bulge out of the anus, leading to further discomfort. External piles, these form under the skin around the anus and are easily visible and more painful. They can cause itching, swelling, irritation, and even blood clots, thrombosed hemorrhoids, leading to severe pain. Unlike internal piles, external piles are more likely to be felt as small lumps or swollen areas near the anus. While piles are generally not life-threatening, they can cause significant discomfort and interfere with daily life. The good news is that with the right care and treatment, they can often be managed effectively without surgery. Common causes of piles. Piles can develop due to several lifestyle, dietary, and physiological factors. Understanding these causes can help in preventing and managing the condition effectively. Chronic constipation or diarrhea, when you frequently strain during bowel movements, increases pressure on the blood vessels in the rectum and anus. Constipation leads to hard stools that require forceful pushing, while diarrhea causes repeated irritation of the anal area. Both can weaken the veins, making them prone to swelling and inflammation. Prolonged sitting for extended hours, especially on hard surfaces or a toilet seat, can restrict blood flow to the rectal area. This can lead to increased pressure on the veins, causing them to swell and form piles. Office workers, truck drivers, and individuals with sedentary lifestyles are at a higher risk. Obesity, carrying excess body weight, puts additional pressure on the lower abdomen and rectal veins, increasing the risk of developing piles. People who are overweight also tend to have poor dietary habits and reduced physical activity, both of which contribute to digestive issues like constipation. Pregnancy. During pregnancy, the growing uterus presses against the veins in the pelvic region, restricting blood flow and leading to swollen hemorrhoidal veins. Hormonal changes can also slow down digestion, causing constipation, which further increases the likelihood of piles. While these hemorrhoids often disappear after childbirth, they can be extremely uncomfortable during pregnancy. Low-fiber diet. A diet lacking in fiber results in hard, dry stools, which require excessive straining during bowel movements. Fiber helps add bulk and softness to stools, making them easier to pass. Diets high in processed foods, refined carbohydrates, and low in fruits and vegetables significantly increase the risk of piles. Heavy lifting. Frequent lifting of heavy objects, weights, or even children without proper posture can strain the abdominal and rectal veins. Repeated pressure from lifting increases the likelihood of hemorrhoidal veins becoming swollen over time. Since piles can range from mild discomfort to severe pain and bleeding, Early treatment and prevention strategies are essential to avoid complications. Simple lifestyle and dietary changes can go a long way in reducing the risk of developing hemorrhoids. Symptoms of piles. Piles may not always cause noticeable symptoms, and in some cases, they may resolve on their own. However, when symptoms do appear, they can range from mild discomfort to severe pain, depending on the type and severity of the hemorrhoids. Common symptoms include pain or discomfort. This is especially noticeable when sitting for long periods or during bowel movements. The pain can be sharp, throbbing, or a dull ache, depending on the severity of the piles. Internal piles are usually painless unless they become prolapsed, while external piles can be quite painful. Bleeding, bright red blood may appear on toilet paper, in the stool, or in the toilet bowl after a bowel movement. This is usually painless but can be alarming. Frequent bleeding can lead to iron deficiency anemia if left untreated. Itching and irritation. The swollen blood vessels around the anus may cause persistent itching and discomfort. This is often due to mucus secretion from the hemorrhoids, which can lead to skin irritation and inflammation. Scratching the area may worsen the irritation, leading to further discomfort. Swelling. The affected area around the anus may become swollen due to inflammation and engorgement of blood vessels. This swelling can cause pressure and a feeling of fullness, making it uncomfortable to sit or move around. Lumps near the anus. External piles may form small, tender lumps or bulges near the anal opening. These lumps can become thrombosed, meaning a blood clot forms inside them, making them hard, swollen, and extremely painful. If left untreated, piles can become more severe, leading to complications such as thrombosed hemorrhoids, painful blood clots in external piles, or prolapsed hemorrhoids, where internal piles bulge out of the anus and may require manual pushing back in. In rare cases, chronic piles may lead to persistent bleeding, infection, or ulceration in the affected area. Early detection and management of symptoms can prevent complications and improve comfort. Now, let's explore the best non-surgical ways to treat piles and get long-term relief. How to treat piles without surgery. Number 1. Fiber-rich diet, the first step to healing. One of the biggest reasons for piles is constipation, which leads to excessive straining during bowel movements. This puts pressure on the veins in the rectum, causing them to swell and become inflamed. The easiest and most natural way to prevent and manage piles is to increase your fiber intake. A high-fiber diet softens the stool, making it easier to pass, reducing the need for straining, and preventing further irritation. How fiber helps. Adds bulk to stool. Fiber increases stool size, making it easier to pass. Softens stool. Prevents hard, dry stools that require straining. Supports healthy digestion. Helps regulate bowel movements, and prevents constipation. How to incorporate more fiber into your diet. Eat more fiber-rich foods. Whole grains, fresh fruits, vegetables, legumes, nuts, and seeds are excellent sources of fiber. Try to include them in every meal. Drink plenty of water. At least 8 to 10 glasses of water daily ensures fiber works effectively by keeping the stool soft. Without enough hydration, fiber can have the opposite effect and lead to bloating or harder stools. Avoid processed and low-fiber foods. Junk food, refined sugars, white flour, and fried items contribute to constipation and make piles worse. Instead, opt for natural, unprocessed foods. Best fiber-rich foods for piles. Leafy greens, spinach, kale, cabbage, lettuce, collard greens, high in fiber and antioxidants that promote gut health. Apples and pears with skin. The skin contains insoluble fiber, which helps stool pass more easily. Oats and whole grains, brown rice, whole wheat bread, quinoa, barley, bran, improve digestion and prevent constipation. Carrots and beets, packed with fiber and anti-inflammatory properties that soothe piles. Nuts and seeds, almonds, flax seeds, chia seeds, pumpkin seeds, walnuts, great sources of fiber and healthy fats that support digestion. Additional tips for a fiber-rich diet. Gradually increase fiber intake. A sudden increase in fiber may cause bloating or gas. Slowly add fiber-rich foods to your diet to allow your digestive system to adjust. Include fiber in every meal. Have oatmeal for breakfast, a salad with lunch, and a serving of vegetables with dinner. Snack smart. Instead of chips, opt for nuts, seeds, or fruit. Start your day right. Drink a glass of warm water with lemon every morning to boost digestion and prevent constipation. By making these small dietary changes, you can improve your gut health, prevent constipation, and heal piles naturally. Number 2. Sitz baths, soothing relief at home. A Sitz bath is one of the simplest and most effective ways to relieve pain, itching, and swelling caused by piles. It works by improving blood circulation in the anal region, reducing inflammation, and promoting faster healing. This method is particularly beneficial for external piles and can provide instant relief from discomfort. How to take a Sitz bath. Fill a tub or a Sitz bath basin with warm water, not too hot, as excessive heat can worsen irritation. If using a standard bathtub, fill it with enough water to submerge the affected area completely. Add soothing ingredients like Epsom salt, baking soda, or witch hazel. These help reduce swelling, fight infections, and provide a calming effect on irritated skin. You can also add a few drops of lavender or chamomile essential oil for extra relaxation. Sit comfortably in the water for 15 to 20 minutes. Ensure your buttocks and anal region are fully submerged to allow the warm water to do its work. Gently pat dry the area after finishing. Avoid rubbing, as this can cause further irritation. Number 3. Topical natural remedies. Instant comfort. Nature has provided us with powerful anti-inflammatory ingredients that can soothe the pain, swelling, and irritation caused by piles. These remedies are safe, effective, and easy to use at home. Aloe vera gel. Known for its cooling and anti-inflammatory properties, aloe vera helps reduce swelling, relieve itching, and speed up the healing process. It also forms a protective barrier that prevents further irritation. Use fresh aloe gel directly from the plant for the best results. Coconut oil, a natural moisturizer with antibacterial and anti-inflammatory properties. Coconut oil soothes the affected area, reduces itching, and prevents infection. Regular application keeps the skin soft and helps shrink hemorrhoids over time. Witch hazel, a natural astringent that shrinks swollen veins and relieves itching, burning, and irritation. Witch hazel is often available as liquid extract, wipes, or creams. Applying it regularly helps tighten the skin and reduce discomfort. Ice packs. Applying a cold compress or ice pack to the affected area provides instant pain relief by numbing the region and reducing swelling. Always wrap ice in a clean cloth before applying to avoid direct skin damage. How to apply. Clean the affected area gently with warm water and mild soap. Pat dry with a soft towel. Do not rub, as it may worsen irritation. Apply a small amount of aloe vera gel, coconut oil, or witch hazel to the piles using a cotton pad or clean fingers. For ice packs, wrap ice in a cloth and apply for 10 to 15 minutes, repeating as needed throughout the day. Use these remedies 2 to 3 times daily or whenever you feel discomfort. These natural solutions provide soothing relief while promoting healing, making them excellent alternatives to medicated creams. Number 4. Herbal remedies for piles. Traditional herbal treatments have been used for centuries to treat piles naturally, offering relief from pain, swelling, and discomfort. These herbs work by improving digestion, strengthening blood vessels, and reducing inflammation. Best herbal remedies for piles. Triphala powder, a well-known Ayurvedic blend of 3 fruits, amalaki, bibitaki, and haritaki, that supports digestion and relieves constipation. Since constipation is a major cause of piles, taking Triphala regularly helps soften stools and reduce straining. It is commonly consumed as a powder mixed with warm water before bedtime. Butcher's broom. This powerful herb helps strengthen blood vessels and reduce swelling, making it highly effective for treating hemorrhoids. It contains rascogenins, which have anti-inflammatory properties and help improve circulation. Butcher's broom is available in capsule or tea form. Horse chestnut extract, often used to treat varicose veins. This herb improves circulation and reduces inflammation, helping to shrink swollen hemorrhoids. It contains zesin, which helps tone the veins and reduce discomfort. It is usually available as a supplement, ointment, or tea. Turmeric, famous for its anti-inflammatory and healing properties, turmeric helps reduce swelling, fight infections, and promote healing of damaged tissues. It can be taken internally as a tea or supplement or applied topically by mixing turmeric powder with coconut oil to soothe the affected area. How to use these herbs for piles treatment. Triphala powder. Mix 1 teaspoon with warm water before bed. Butcher's broom tea. Steep 1 teaspoon of dried root in hot water for 10 minutes and drink twice daily. Horse chestnut supplement. Take as per dosage instructions on the packaging, usually 300 milligrams daily. Turmeric paste. Mix 1 teaspoon of turmeric powder with coconut oil and apply to external piles for relief. By incorporating these herbal remedies into your daily routine, you can naturally reduce pile symptoms and promote faster healing without needing surgery. Number 5. Exercise. Move to improve. A sedentary lifestyle is one of the biggest contributors to piles. Sitting for long hours, especially on hard surfaces, puts excessive pressure on the rectal veins, leading to swelling and discomfort. Regular physical activity not only improves digestion, but also promotes healthy blood circulation, reducing inflammation and helping shrink piles naturally. Here are some of the best exercises to relieve and prevent piles. Walking, a simple yet highly effective exercise. Walking for at least 30 minutes a day stimulates bowel movements, prevents constipation, and reduces pressure on the veins. It is one of the easiest ways to stay active without straining the body. Yoga and stretching. Certain yoga poses are specifically beneficial for people suffering from piles. Malasana, squat pose, enhances digestion and relieves pressure from the anal region. Pawanmuktasana, wind-relieving pose, helps in releasing trapped gas and improves bowel movement, reducing constipation. Viparita Karani, legs up the wall pose, encourages better blood circulation and reduces swelling in the rectal veins. Avoid heavy lifting. Strenuous weightlifting or activities that involve excessive straining can worsen piles. Instead, opt for low-impact exercises like swimming, cycling with a cushioned seat, and light strength training to stay fit without aggravating symptoms. Regular exercise not only reduces the risk of piles but also prevents recurrence by maintaining a healthy digestive system and improving overall circulation. Number 6. Over-the-counter OTC treatments. If home remedies aren't enough, consider mild medications to help reduce symptoms and promote healing. Stool softeners like docusate sodium prevent straining by softening stools, making bowel movements easier and less painful. Over-the-counter creams like hydrocortisone, lidocaine, or anusol cream. These creams provide relief from itching, swelling, and discomfort. Anusol cream is particularly effective as it contains zinc oxide, bismuth oxide, and balsam Peru, which help protect irritated skin, reduce swelling, and promote healing. Hemorrhoid suppositories. Designed to help with internal piles, these suppositories deliver medication directly to the affected area, reducing inflammation and discomfort. These medications can provide quick relief, but always consult a doctor before prolonged use, especially if symptoms persist or worsen. When to see a doctor. While mild to moderate cases of piles can often be managed with home remedies and lifestyle changes, there are times when professional medical attention is necessary. Ignoring severe symptoms can lead to complications such as persistent bleeding, infections, or thrombosed hemorrhoids, blood clots in external piles. Severe, persistent pain. If the discomfort becomes unbearable despite home treatments, it may indicate a more serious issue like a thrombosed hemorrhoid, which requires medical intervention. Heavy bleeding. If you notice frequent or excessive rectal bleeding, especially if accompanied by dizziness, weakness, or anemia, low iron levels, consult a doctor immediately. Large, prolapsed piles hanging out of the anus. If hemorrhoids protrude outside the anus and do not retract on their own, they may require medical procedures to shrink or remove them. No improvement after 2 weeks. If symptoms persist or worsen despite using dietary changes, Sitz baths, and topical treatments, professional evaluation is necessary to prevent further complications. If any of these symptoms occur, your doctor may recommend minimally invasive, non-surgical treatments, which are effective and require little to no downtime. Rubber band ligation. A small band is placed around the hemorrhoid's base, cutting off its blood supply. The pile shrinks and falls off within a few days. This method is highly effective for internal hemorrhoids. Sclerotherapy, a medical-grade chemical solution, is injected into the hemorrhoid, causing it to shrink and gradually disappear. It is a quick, outpatient procedure with minimal discomfort. Laser therapy, a non-invasive technique that uses laser energy to shrink and remove hemorrhoids with precision. It causes less pain and faster recovery compared to traditional surgery. These treatments are safe, quick, and nearly painless, making them ideal alternatives to surgical removal. If left untreated, severe hemorrhoids can lead to complications like anemia due to chronic blood loss, infections, or severe thrombosis. Seeking timely medical help ensures effective relief and prevents long-term discomfort. Final thoughts: you can beat piles naturally. Piles may feel like a constant struggle, but remember, they don't have to control your life. With the right combination of dietary changes, natural remedies, and healthier habits, you can not only manage but also heal naturally and avoid the need for surgery. It's all about making small, sustainable adjustments to improve your digestive health and reduce strain on your body. There's no reason to suffer in silence. With a proactive approach, you can relieve discomfort, prevent future flare-ups, and ultimately regain control of your life. So take action today to make these changes and feel empowered. The relief is within reach, and you don't have to face it alone. Key takeaways: eat fiber-rich foods and drink plenty of water to keep things flowing smoothly and prevent constipation. Use Sitz baths and natural remedies like aloe vera, witch hazel, or coconut oil to soothe and heal irritated areas. Stay active. Incorporating light exercise into your routine will help keep digestion regular and reduce the risk of piles. Try OTC treatments for temporary relief when symptoms become too uncomfortable to handle. Consult a doctor if symptoms worsen or if you experience severe pain or bleeding. Early intervention can help prevent complications. Remember, you're not alone. Millions of people have successfully overcome piles without surgery and found lasting relief with natural remedies and lifestyle changes. You can too. Start today, take control of your health, and enjoy a pain-free life. You deserve it. Now that we have discussed piles treatment without surgery, you might want to dive into other topics of interest, like knowing more about common habits that make you age faster without you even noticing it, or taking note of the early warning signs of heart attack. Let's keep the conversation going with a couple of more health-related videos for awesome wellness. Go ahead, click one, or better yet, watch both and learn more. If you have any questions or suggestions for future video topics, please let us know in the comments below. We love hearing from you and are committed to providing you with valuable information to support your well-being. Wishing you all the best and see you on the next video.